So we can start the page 61. So it is starting with the Vibhinna Bhaknon ka Samanya Lakshana. Okay, so the Samanya Lakshana of the fractures. Okay, so the first 6 are classification of Sandhi Mukta. Okay, Utpishta, Vishlishta, Vivartida, Avakshipta, Adikshipta, Tiryak. So this much are classification of Sandhi Mukta. So 6 types of Sandhi Mukta is there. Okay, so that is Utpishta, Vishlishta, Vivartida, Avakshipta, Adikshipta, Tiryak. And the rest of the from Karkada till Spudida, these are all classification of Bhakna. Okay, Sandhi Mukta classified into 6 types. Bhakna is classified into 12 types. So the 12 types are Karkadaga, Ashvakarna, Pichida, Asti Chalida, Kanda Bhakna, Majjanugada, Adipadida, Vakra, Chinna, Patida, Spudida. So these are the 12 types of Bhakna. Okay, so there's Samanya Lakshana we can see. So the first one is Utpishta. So Utpishta means Dono Pashvam par Peda, Ratri me Vishesha Vedana. Okay, so Dono Pashva, which means there will be severe swelling and pain you can get in the both the side of the body, both the side of the joint. Okay, so Utpishta, it is a variety of Sandhi Mukta. So the Lakshana is there will be swelling and pain in both the side of the joint, and you will be getting severe pain in the night time. Okay, so that is a very important point related with the Utpishta. Okay, so the pain increases especially at the night time. That is a feature of Utpishta. Then next one is Vishlishta. So there will be Alpashofa, mild swelling will be there. Sadada Vedana, continuous pain will be there. Day and night continuous pain you can get in Vishlishta. Okay, mild swelling, continuous pain will be there, that is in Vishlishta. Utpishta, swelling will be there in the both the side of the joint, and in especially in the night time severe pain will be there. Next one is Vivartida. Vishamangada, there will be, because of the dislocation you will be getting the deformity. Okay, so the joint usually in the Vivartida, what is happening means the joint is dislocated to one side. So because of that what happened? Deformity will be getting Vishamangada. So there will be deformity plus Vedana, there will be severe pain will be there. Okay, so these are the symptoms of the Vivartida. Next one is Avakshipta. So Sandhi Vishlesha, there will be drooping down of Sandhi will be there. Okay, drooping down of the joint plus Tivra Pida, severe pain you will be getting. Okay, so Ratri Vishesha Vedana, it is a feature of Utpishta. Sadada Vedana, it is a feature of Vishlishta. Tivra Pida you will be getting in Avakshipta. Okay, severe pain you will be getting in Avakshipta, and there will be Sandhi Vishlesha, drooping down of the joint you can see in the Avakshipta. Then Adikshipta, Dono Sandhiyon ka dur dur hor jana, which means both in the joint the both bonds will be there, no? Two bonds will be joining together, the joint Sandhi will be forming. So the bonds will be moving apart. Okay, so there will be a gap will be created between these two bonds. Okay, so the bonds will become moved apart because of the dislocation. So there is a gap will be created. So that is called as Adikshipta. The last one is Tiryakshipta. Astika Eka Pashme Girjana. So there will be one bond will become dislocated to the side. Okay, Astika Eka Pashme, so which means the one portion. Okay, so any one bond that will become displaced to a one of the side, that is called as Tiryakshipta. Okay, so these are the Samanya Lakshana of the 6 types of Sandhi Mukta. Next one is this Bhakna varieties. 12 types of Bhakna is there. So the first one is Karkadaga. Ubhayado Ubhar Madhyame Bhakna. So here what is happening means there will be the fracture will be happening, and in the middle of the fracture there will be one tumor will be arising, and the tumor will be resembling like a crab. Okay, so crab like one tumor will be arising. Okay, so the bone will become fracture, and in the middle of the fracture there will be bulging will be forming, so that like a tumor will be arising, so that will be looking like a crab, so that is called Karkadaga. Okay, so the broken end of the bones will become fracture and they will be moving apart, and from that middle portion there will be a tumor like one swelling will be arising, so that is called as karkadaga. Then Ashwakarna. घोड़े के कर्ण सदृश भग्न, so you will be getting a fracture and from that fracture will be looking like a ear of the horse. Okay, Ashwakarna. Karna means ear, Ashwa means horse. So ear of the horse, how it will be there? In that way, the fracture will be looking. So that is called Ashwakarna. Next one is Pichida. Prutuva Alpayukta. Sorry, Prutuva Alpa Shofayukta. So here what is happening? There will be bone will become very thick. Okay, Prutu, the bone will become very thick and there will be Alpa Shofa. So there will be mild swelling will be there. So that is called as Pichida. नेक्स्ट वन इज अस्थि चलिता. एक तरफ से ऊंचा व एक तरफ से नीचा. सो इन अस्थि चलिता व्हाट इज हैपनिंग आफ्टर द फ्रैक्चर वन पार्ट ऑफ द बोन विल बी ड्रूपिंग डाउन एंड वन पार्ट विल बी एलिवेटेड. इन दैट पोजिशन इफ यू आर गेटिंग दैट इज कॉल्ड अस्थि चलिता. Okay, so the bones will become fractured, so the one portion will go upward direction, one portion will go downward direction, that is called asti chalita. Then Kanda Bhagna. So in Kanda Bhagna, Hilane par Prakampamana. Okay, so there will be fracture will be happen, and after the fracture when there is a shaking movement will be occurring, so that time severe pain will be getting. Okay, so Hilane, there will be a fracture will be happening, then after the fracture there will be movement will be getting. So the fracture bone has tremor, that is the clinical feature of Kanda Bhagna. Okay, fracture bone has getting tremor, that is a clinical feature of Kanda Bhagna. Hilane par Prakampamana. Next one is Majjanugada. So Majjanugada, Asti mein Asti Pravesha, which means after the fracture the piece of the bone is getting inside into the bone marrow, that is called as Majjanugada. Adipadita, Nisheshadaha Chinna. So the entire bone will become broken into pieces. Okay, so the entire bone will become broken into many pieces, so that is called Adipadita. Next one is Vakra. Abhukna Mukha Magar Amukta. So the bone will become bending. Okay, bone is bending inward or it is getting curved. So that is called Vakra. Okay, so bone is getting it is not getting completely fractured, it is getting bending inward position, that is called Vakra. नेक्स्ट वन इज चिन्ना. एक तरफ से जुड़ा हुआ मगर दूसरी तरफ से पूर्णतः चिन्ना. So after the fracture the bone will be moving to the other side, that is a clinical feature of चिन्ना. Okay, so एक तरफ से जुड़ा हुआ, so one bone has moved to the other side and the other portion has become broken into pieces, so that is the symptom of चिन्ना. Next one is Patita. Anega rekha omse yukta. So the bone will be splitted into many pieces. Okay, so that is called Patita. Like multiple fracture lines will be getting in the bone, so that is called as Patita. Next one is Skutita. Shuga Purnava Atmanase Yukta. So there will be, after the fracture there is a swelling will be happening, and if you touch it you can feel it is filled with the thorns. Okay, THORNS, filled with the thorns. That is the clinical feature of Sputita. Okay, so after the fracture there will be swelling will be happen. If you touch that area you can feel that swelling is filled with the thorns. So that is the clinical feature of Sputita. There is one more type of Bhakna is there, that is Churnida. Okay, here 11 types of Bhakna only mentioned. So one more, the last one is that is Churnida. Okay, so in Churnida what is happening means the bones will producing sound. Okay, when they are fracturing they will be producing severe sound, and that is called as, and then after that producing the sound there will be, that fracture will become broken into pieces. Okay, so that is called Churnida. It will become like a powder like structure will become. Okay, the fracture, when the fracture is occurring, so that time severe sound will be producing. Then after that the broken pieces will become like a powdered form. So that is called as Churnida. That is the lection of the Churnida. So these are the 12 types of Kanda Bhagna. Okay, so these are the Samanya lection of the different varieties of Bhagna. Okay, then next one is Bhagna Bandhana Kala. Once you have got fracture and we will be doing the bandaging, so at which time that healing will be occurring. If this is happening in the Saumya Rudu, within 7 days the Bhagna will become joining together. Okay, Bhagna Sandhana Kala will be happening within 7 days if it is occurring in the Saumya Rudu. If it is occurring in the Sadharana Ridu, bandage. Okay, so if you are getting fracture in the Saumya Ridu, bandage should be done for 7 days. For in Sadharana Ridu, the bandage should be done for 5 days. In Agneya Ridu, we should done for 3 days. Okay, so this is the Bandhana Kala for Bhagna. Okay, based on the Ridu, you have to tell. Saumya Ridu 7 days, Sadharana Ridu 5, Agneya Ridu 3 days. So with this much time, we have to do the bandaging. Then Churnida, Chinna, Adipadida, Majjanugada Bhagna, Asadhyamane Gayehe. So Churnida, Chinna, Adipadida, Majjanugada Bhagna, these are all Asadhya. Then Siraveda in Shlipada. Okay, so Siraveda is indicated, so the location is very important. So in Vadaja Shlipada, you should do Siraveda in Gulfake 4 angula upar. So 4 angula above the Gulfa, that is the location for Siraveda in Vadaja Shlipada. In Pittaja Shlipada, Gulfake niche Siraveda has to be done. Like below the Gulfa, 4 angula below the Gulfa, you have to do the Siraveda in Pittaja. Okay, 4 angula below the Gulfa, that is the location where the Siraveda has to be done for Pittaja Shlipada. In Kafaja Shlipada, Ankuteke Prasiddha. Siraka, like in Angushta, you have to do the Siraveda in Kafaja Shlipada. So these are the locations where you have to do Siraveda in the each Shlipada, Vada, Pitta, Kafa. Then Sannipadika Grindhi, Vriddhi, Arbuda va Adimanda nahi hote hai. So Sannipadika Grindhi, Sannipadika Vriddhi, Sannipadika Arbuda, Sannipadika Adimanda. So this type of conditions will not be occurring. Sannipadika Grahani hoti hai, magar Sannipadika Pravahika nahi hoti hai. Sannipadika Grahani is there, but Sannipadika Pravahika condition is not happen. Okay, so Sannipadika Pravahika is not there, but Sannipadika Grahani is there. Then you can see Talu Pupputa Kadara. Okay, so in these disorders we will be getting the swelling, and the swelling size will be Kola Pramana. Okay, Kanda Shaluga, there also swelling will be getting, the size of the swelling is Kolasti Pramana. Gilayu, Apaji, here also the swelling will be size is Amlagasti Pramana. So the swelling size they can ask. Okay, so Talu Puppuda Kadara, the swelling size will be Kola Pramana, Kanda Shaluga Kolasti, Gilayu, Apaji, in these conditions the swelling will be occurring the size of Amlagasti. Next one is Chudra Roga Lakshanas. Okay, so Balanam Ajagallika. So Ajagallika, it is a blister formation, and this Ajagallika usually occurs in the children. Okay, so Balanam. So Ajagallika more commonly it occurs in the children. Then Mukharehida Andhalaji. So Andhalaji means here also you are getting severe blister formation, but it is not occurring in the face. Rest of the body parts you will be getting this eruption, so that is called as Andhalaji. Next one is Vivrida, Pakwa Udumbara Sannibha. So there will be severe eruption will be there, and that eruption will be looking like a Pakwa Udumbara. So that Chudra Roga is called as Vivrida. Next one is Kachabi. Okay, so Panjashad Kachaba Unnada. So there is a one severe elevation will be like severe swelling will be happening, and that swelling will be looking like a tortoise shell. So that Chudra Roga is called as Kachabi. Next one is Patma Pushkaravat Madhye Indra Vriddha. So Patma Pushkaravat, which means like a shape of the lotus bud. Okay, like a shape of the lotus bud, if you are getting an eruption, so that is called as Indra Vriddha. You are getting a small blister formation that is looking like a Patma Pushkara, so that is called as Indra Vriddha. Then Panasika. So Panasika, here also you are getting a blister formation that will be looking like a Shaluga. Okay, Shalugavat Panasika. So the painful blister will be occurring. It is similar to the Shaluga. So that is called as Panasika, shape of the blister. Next one is Agni Rohini. Kakshabhageshu spota jayande mamsadharana. So you are getting a severe eruption which is occurring in the Kakshabhaga, in the armpit area. You are getting a severe eruption and there will be severe burning sensation. Muscle like tissues are getting damaging. So that condition is called Agni Rohini. Okay, so spot, there will be blister will be forming in the Kakshabhaga and followed by severe burning sensation. Damage of the tissues will be happening. So that Kshudra Roga is called as Agni Rohini. Next one is Vidarika, Vidari Kandavat. You are getting an eruption which is similar to the shape of Vidari, that is called as Vidarika. Padmini Kandagavat, Padmini Kandaka. So Padmini Kandaka, here also you are getting a swelling which is similar to the thorn of the lotus plant. Okay, Padmini Kandaka. Kandaka means thorn. Padmini lotus. Okay, so the thorns of the lotus, how it will be looking like, in that way you are getting an eruption in the skin, that is called as Padmini Kandaka. Then Mukhadushika. Mukhadushika, we know it is, we can correlate with the acne vulgaris. So Shalmali Kandaga Prakya. So you are getting a this swelling, that small eruption that will be looking like a Shalmali Kandaga. In that way, if you are getting a small swelling in the face, so that is called as Mukhadushika. So these are some of the clinical features of the some Kshudra Roga. Next, they have mentioned some formulations, and that formulations is comes under the which disorder they have mentioned. Okay, so very important. Pinda Thaila, it is mentioned under Vadarakta Chikilsa. Pindasava, that is indicated in Grahani Roga. Pinda Rasa is there, that is mentioned under Vrishya. Okay, so Pinda Thaila, Pindasava, Pinda Rasa is there. Okay, then Bahushala Guda, that is mentioned under Ashras. Guda Ardraga, it is mentioned under Shoda. Gudodana, that is mentioned under Vadaja Swarabheda. Sarpir Guda, it is indicated in Kshadakshina. Okay, Bahushala Guda in Ashras Roga, Gudardraga in Shoda, Gudodana, it is indicated in Vadaja Swarabheda, Sarpi Guda, it is indicated in Kshadakshina. So they will mention some formulation and they will tell you in which condition it is indicated. So this is very, very important. Then Kamsa Hariteki, that is indicated in Shoda. Guda Hariteki, that is mentioned under Vadarakta according to Sushruta, but according to Charaga, it is mentioned under Ashras. Okay, Guda Haritaki. Then Chitraga Haritaki, that is indicated in Nasa Roga and Pradishyaya. And this Chitraga Haritaki is not mentioned by Charaga. Okay, so this is mentioned by Sushruta. He has included this Chitraga, he has mentioned this Chitraga Haritaki in Nasa Roga and Pradishyaya Chikilsa. Then Agastya Haritaki, it is indicated in Kasa and Shwasa Roga. Dandi Haritaki is mentioned under Ashras and Gulma Roga. In both the conditions you can see Dandi Haritaki. Vyagri Haritaki, that is indicated in Nasa Roga and Pradishyaya. These are the different type of Haritaki formulations. Next one is Siddharthaga Agata, it is indicated in Unmada. Siddharthaga Grida, that is indicated in Abasmara. Siddharthaga Snana, it is mentioned under Kushtaroga. Siddharthaga Taila, it is mentioned under Aparapadana. Okay, Aparapadana, removal of the placenta. Okay, placenta removal. So in that conditions you can give Siddharthaga Taila. Then Jayantaka Svedaka Sevana Konsi Rudu mein nirdishta hai, Hemanda Rudu. So Jayantaka Sveda is indicated in Hemanda Rudu. Then Chakrapani Mada Anusara Mrudu Madhyama Tikshna Virya Dravya Ki Matra. Like Mrudu Madhyama Tikshna Virya Dravya Sadar. So there is a particular dosage they have mentioned, because Tikshna Virya Dravya, example for Tikshna Virya Dravya is Shundi. So how much you have to take Shundi? 1 karsha. Because if you take more Tikshna Virya Dravya, it can create disorders in the body. So that's why how much you have to take Tikshna Virya Dravya, that should be 1 karsha. So example for Tikshna Virya Dravya is Shundi. Okay, so sometimes they can ask in the exam, like which one among is Tikshna Virya, which one is Mridu Virya, which one is having Madhyama Virya. So like that question you can get. So the examples are very important. So example for Tikshna Virya is Shundi. How much Matra should be taken? 1 karsha. Madhyama Virya example is Bilva. Okay, so dosage is half pala. Then Mridu Virya example is Amlaki, and how much dosage we can take Mridu Virya Dravyas? 1 pala. Okay, so these are the 3 types of Virya and the dosage. And this is mentioned by Chakrapani. Next one is Prameha Anusara Vishishta Dravya. So for each Prameha, there is 20 types of Pramehas are there. For each variety, there is particular Kashaya is indicated. So here in Udaka Meha, Parijada Kashaya is mentioned. Okay, for Udaka Meha, Parijada Kashaya is indicated. For Madhu Meha, Shveda Kadira or Puga Phala Kashaya has to be given. Okay, for treating Madhumeha, Shveda Kadira and Puga Phala Dravyas are indicated. Then Rekta Arshokna Dravya, which are the Dravyas which is used for the Rekta Arshas, that is Kudaja, Indrayava, Daru Haridra, Naga Keshara, Changeri, Yavasa. These are the Rekta Arshokna Dravya. Vada Arshokna Dravyas are Chitraga, Bhelladaka, Surana, Mahanimba, Adivisha, Bilva. Okay, then next they have mentioned about the Krimikna Dravya. Okay, different type of Krimis are there. For that each Dravyas they have mentioned. Spida Krimi for them, Dadimatva Kampillaga Puga has indicated. Angusha Krimi for that Belladaka Taila Yavani Sattva. For Snayuga Krimi Nirgundi and Shigru. For Shlipada Krimi Shakotaka. For Gendubada Krimi Palasha Bija Vidanga Chauhara Paribhadra Indrayava. So these are the Dravyas which is indicated for the different type of Krimi. Next one is difference between Gendusha and Kavala. Okay, so this Gendusha and Kavala, it comes under the Panchakarma procedure. So the Gendusha means you will be filling your mouth with the fluid. Okay, water or Kashaya, Swarasa, whichever liquid you have to be taken, it should be filled with the mouth. Okay, so Gandusha, that is called like you are filling the mouth with the fluid, and there will be no movement of the fluid will be happening. So that procedure is called as Gandusha, Asanjari. Okay, there will be no movement of the water will be happen. Kabala, here what is we are doing means the half of, like the mouth will be filled with the water, but it will be half only we are filling. Okay, mouth, half of the mouth portion will be filled with the water. So what happens? The water can move. Okay, Sanjari, like a gargling procedure. So in gargling, what we are taking little bit of water and the movement of the water will be doing. No? So that is called Kabala, or it is gargling procedure. In Gendusha, you are filling the mouth with the water. So there will be no movement of the water will be happening. So that procedure is called Gendusha. The movement of the water will be happening. That is called Kabala. Okay, Asanjari, Gendusha, Sanjari is Kabala. The next one is they have mentioned about the 6 Ridu, and the 6 Ridu comes under the which of the month they have mentioned. Okay, so Shishira in modern month it comes under January and February. Charaga Anusar, which are the months? Magha and Falguna. Susruda Anusar, Taba or Tabasya. Then according to Sharangadra, Miduna and Karka, these are the months where the Shishira Ridu will be occurring. Vasanta Ridu, according to the modern, March and April is the Vasanta Ridu. According to Charaga, the months which is told by Charaga, that is Chaitra and Vaishaga. According to Susruda, Madhu and Madhava. According to Sharangadra, Meen and Kumbharashi. Then Grishma Ridu, in the month May and June is Grishma Ridu. But according to Charaga, it is Jeshta and Ashada. Susruda Anusar, Shuji and Shukra. These are the month name. Then according to Sharangadra, Mesha and Vrisha Rashi. Then Varsha Ridu, it comes under July and August. So according to Charaga Anusar months, Shravana and Bhadrapada. According to Susruda Anusar, Nabha and Nabhasya. According to Sharangadra, Simha and Kanya Rashi. Sharat Ritu, it comes under September and October. Then according to Charaga Anusar, Ashwini and Kartika months, it comes under Sharat Ritu. And according to Susruda, Isha and Urja. According to Sharangadra, Tula and Vrishchika Rashi. Then Hemant Ritu comes under the November and December. So according to Charaga, it is Agahana and Pausha Masa. According to Susruda, Saha or Sahasya. According to Sharangadra, Dhanu and Magara Rashi. So in these timings, this Ridus will be coming. Next one is Ridu Sandhi. Ridu Sandhi means, so there will be junction between the two seasons. When the Shishira Ridu is finishing and then Vasanta Ridu is starting. Okay, so that there is a junction, the junction between the two seasons, that is called Ridu Sandhi. Okay, that term is mentioned by Vagbhata. So Ridu Sandhi time duration is 14 days. So when the Shishira Ridu is finishing, the last 7 days, and the starting of the Vasanta Ridu, the first 7 days. Okay. So this 14 days is considered as Ridu Sandhi, the junction of the two seasons. Okay, so Shishira Ritu, the last 7 days of the Shishira Ritu and the first 7 days of the Vasanta Ritu. So these total 14 days is considered as the Ritu Sandhi, the Ritu Sandhi. Okay, this is mentioned by Vagbhata. The same thing is mentioned by Sharangadra in the term Yamadamshtra. Okay, but he has mentioned 16 days as the duration. 8 days of the last season and the first 8 days of the new season. Okay, so that is called Yamadamshtra. That is 16 days duration. Ritu Sandhi 14 days duration. Ritu Sandhi is mentioned by Vagbhata. Yamadamshtra, that term is mentioned by Sharangadra. Both are telling same thing, only the terms are different and the duration is also different. Next one is Belladagasti. Belladagasti means the seed of the Belladaga. Okay, seed of the Belladaga is called as Belladagasti. So that comes under the Kaduskanda. Okay, Belladagasti, it comes under the Kaduskanda. Belladaga comes under the Kashaya Skanda. Okay, Belladaga, that is in the modern it is called as marking nut. Okay, Semicarpus anacardium, that is a botanical name. It is English name is marking nut. So the seed of the Belladaga, it comes under the Kaduskanda, and that phala, okay, that fruit is comes under the Kashaya Skanda. Okay, then in Charaka there are so many vargas they have mentioned. The same varga you can see in the Susruta also, but in the different name you can see. Okay, so Jivaniya Gana according to Charaka, the same thing which is mentioned by Susruta under the name of Kakolyadi Gana. Then Brahmaniya Gana, the same thing that is called as Vidari Gandhadi Gana. Deepaniya Gana, that is Pippalyadi Varga. Balya Gana, Lekhu Panchamula. Then Hridya Gana Parushagadi Varga. Okay, Parushagadi. Then Arshogna Mushkagadi Varga. Krimigna Surasadi and Lakshadi Varga. Kasahara Gana is Vidari Gandhadi Varga. Then Shwasa Hara is Pipalyadi and Surasadi Varga. Shodha Hara is Dashamola. Stanya Janana Kakolyadi. Vayastabana Kakolyadi Vidari Gandhadi. Prajastabana Kakolyadi and Vidari Gandhadi. Udarda Prashamana Salasharadi. Angamarda Prashamana Vidari Gandhadi. Shramahara Parushagadi. Shodana Ubhayado Bhagahara Varga. Then Shukra Shodana Valli Panchamola and Kandaga Panchamola. Okay, both are telling same only, the names are different. Okay, so these are the Ganas which is mentioned by Charaka. The same thing is mentioned by Susruta, but under the name of different name they have given. Okay, so Jivaniya, Kakolyadi, both are similar only. Okay, so these is the similarities between the both the Ganas. Then Dashamula, Triphala, Ganaka, Pradamadaha, Varnana Kiya, Susrudane. So Dashamula, Triphala, these are all first of all mentioned by Susruta. Then Trijada, Chadurjada, Madhya Panchamula, Jivana Panchamula, these descriptions are mentioned by Vagbhata. Okay, Dashamula, Triphala is first of all mentioned by Susruta. Trijada, Chadurjada, Madhyama Panchamula, Jivana Panchamula, this type of Vargas are mentioned by Vagbhata. Then Ksheeratraya. Okay, so Ksheeratraya according to Rasatarangini is Arka Ksheera, Vata Ksheera and Snuhi Ksheera. These three togetherly called as Ksheeratraya according to Rasatarangini. Then according to Charaka, Arka, Ashmandaga, Snuhi, these three are Ksheeratraya. Okay, then Paryaya Reknamala, Dravya Guna Reknamala, these are books. Okay, so these books are written by Madhavagara. Okay, Madhavagara written Paryaya Reknamala and Dravya Guna Reknamala. Then Bhava Mishra written Guna Reknamala. Okay, Guna Reknamala book is written by Bhava Mishra. Next one is Janapado Dvamsa. That term is mentioned by Charaka. Janapado Dvamsa means you are getting one condition that is affected by so many people. Like corona, it has affected so many people, no? Like entire so many countries are affected. Okay, so that type of epidemic condition is called as Janapado Dvamsa. Okay, so the term is mentioned by Charaka. The same thing, the different term is mentioned by Susruta, that is Maraga. Okay, Maraga, that is for the epidemic disorders. So the term is mentioned by Susruta. Janamara. Okay, so that term is mentioned by Bhela. So these three terms are indicating epidemic disorders. The terms are different terms used by different acharyas. Then among the Panchendriya, Pradhana Indriya is Chakshurendriya. Okay, among the five Indriyas, the most important Indriya is Chakshurendriya. The vision is the most important one. Vyapaka Indriya, the which Indriya has spreaded all over the body, that is Sparshanendriya. The skin has spreaded all over the body, no? So Sparshanendriya is a Vyapaka Indriya and Pradhana Indriya is Chakshurendriya. Then Adhyatma Dravya Guna Sangraha. Okay, that is one term. Adhyatma Dravya Guna Sangraha. It consists of four: Mana, Mano, Artha, Buddhi and Atma. These four are considered as Adhyatma Dravya Guna Sangraha. Mana and Atma togetherly called as Adhyatma Dravya. Okay, Adhyatma Dravya is two only, Manas and Atma. Adhyatma Dravya Guna Sangraha is four: Mana, Mano, Artha, Buddhi and Atma. Okay, so don't get confused. Adhyatma Dravya Guna Sangraha 4, Adhyatma Dravya is 2, Mana and Atma. Next one is Basti. Okay, we have already seen based on the number 3 type of Basti is there: Karma Basti, Kala Basti, Yoga Basti. Okay, so in that numbers it is very important. Karma Basti is 30, like total 30 bastis are there. So in that how much Niruha, how much Anuvasana will be coming, that already we have seen. So Charaga and Vakpata both are telling total 30 bastis are coming, that is called as Karma Basti. So there is a difference of opinion you will be getting in the Kala Basti. Okay, according to Charaga the number of Kala Basti is 16, according to Vakpata 50. Okay, so definitely you can get question. According to Charaga Kala Basti number is 16, according to Vakpata Kala Basti number is 15. So definitely they will be mentioned that Acharya's name. If they are not mentioning Acharya's name, so just only Kalavasti number they are showing. So in the option it might be 16 or 15 will be there. Both option they don't give you. Okay, so according to Charaka, Kalavasti numbers are 16. According to Vakpata, Kalavasti number is 15. That is very important. Then Yogavasti for according to both the Acharyas are 18 number. Okay, so these are the difference of opinion you will be getting in Charaka and Vakpata. Then Vakpata Anusara Kala Maryada. Okay, like when we have to do the this Shodhana Karmas. Okay, according to Vakpata, Pradimarsha Nasya is indicated 7 to 80 years old. Okay, from the 7 years onwards we can give Pradimarsha Nasya. Okay, and then till 80 years you can follow. Follow 7 to 80 is the, it is not Pradimarsha, it is Marshanasya. Okay, Pradimarsha Nasya from birth onwards we can give. Okay, from birth onwards we can give Pradimarsha Nasya. It is not Pradimarsha. Here they have mentioned about the Marshanasya duration. Okay, so just strike it. It is Marshanasya. So for the Marshanasya 7 to 80 years is the duration they have given. So from 7 years we can start the Marshanasya, till 80 years we can do it. After that it is contraindicated. Pradimarshanasya from Ajanma, like Ajanma Marana, from birth onwards till death we can do Pradimarshanasya. Then Dhumapana from 18 years onwards only we can start Dhumapana. Kabala we can start from 5 years onwards. Then Vamana Virejana it is indicated from 10 to 70 years. So these are the time periods where we have to do the Shodhana therapies. Then according to Sharangadara, Kabala and Gandusha both we can do after 5 years onwards. Nasya it is indicated after 8 years onwards, Marshanasya. Then Virejana is indicated after 16 years. Stri Sangha is indicated after 20 years. Dhumapana is indicated 12 to 80 years. So these are the time duration where you have to give the procedures. 12 to 80, that is a Dhumapana indicated time. Next one is Upanaha Sveda. Okay, Upanaha Sveda according to Charaka it comes under the Nirakni Sveda category. Okay, it comes under the Nirakni Sveda, but according to Sushruta it comes under the Sa Agni Sveda. But according to Chakrapani, Sa Agni, Nirakni, in both the types you can see Upanaha Sveda. According to Charaka, this Upanaha comes under Nirakni. According to Sushruta it comes under the Sa Agni. According to Charaka both is there, Sa Agni Sveda and Nirakni Sveda. In both the types you can see Upanaha Sveda. Next thing they have mentioned about the books and the author. Okay, Nyaya Chandrika, Brihat Panchika. So these books are written by Gayadasa Krita. So that is written like comment. It is a commentary for Susruta Samhita. Okay, Nyaya Chandrika, Brihat Panchika. These are the commentary of Susruta Samhita. It is written by Gayadasa Krita. Padartha Chandrika, it is a commentary of Ashtanga Hridaya. It is written by Chandananda Krita. Okay, Chandra Nandana Krita. This is the author's name, Padartha Chandrika. Charaka Chandrika, it is a commentary of Charaka Samhita. It is written by Gayadasa Krita. Okay, so these are the commentaries and the author's name. Next one is Trifala Sevana Kala. Okay, so Trifala, how we have to take it? Bhojana Purva Vibhidaki. So Charaka is telling, before the starting the meal, you have to take Vibhidaki. Bhojana Paschat, after the meal, you have to take Amlaki. Annaki Jirna Hone par, after the complete digestion of the food, you have to take Haritaki. Okay, so this is the way how you have to take the Trifala. So Vibhidaki, before food, after the food, Amlaki, after the digestion of the food, Haritaki. Okay, Bhela also telling same thing but difference is there. Bhojana Purva Amlaki, then Bhojana Paschat Haritaki, Annaki Jirna Vibhidaki. Okay, according to Bhela, before the meals Amlaki, after the meals Haritaki, after the digestion of the food Vibhidaki. Okay, so this is the way how we have to take the Trifala. Okay, according to Charaka and according to Bhela. Next one is Vipaka ka Sarva Pradama Lakshana Vakbhata ne diya hai. So like Lakshanas of the each Vipaka, Katu Vipaka, Madhura Vipaka, Amla Vipaka. So these Lakshanas are mentioned by Ashtanga Hridaya. Then Vyavayi Dravya mein keval Bhudagni Paga hota hai. So Vyavayi Dravya, like Vyavayi means that Vyavayi Guna is there, no, which is having spreading nature. So that Guna, that Vyavayi Guna Dravya, so that is digestion, that Paga will be done by Bhudagni. Okay, so Bhudagni will be doing the digestion of the Vyavayi Dravya. And Bhudagni Adhishtana is Yakrit. Okay, Yakrit ko Bhudagni evam Dhatwagni ka Adhishtana mana gaya hai. So Bhudagni Dhatwagni Adhishtana is Yakrit. Then आहार द्रव्यों में विशेष रूप से धात्वाग्नि व्यापार एवं औषध द्रव्यों में भूदाग्नि व्यापार द्वारा कार्य होता है. So if you are taking food, okay, the essence of the food is carried by the Dhatwagni. Okay, if you are taking the food, the essence of the food is carried by the Dhatwagni, and if you are taking medicines, though the medicine effect is carried by the Bhudagni. Okay, Aushadha Dravya essence are carried by Bhudagni, Ahara Dravya essence is carried by Dhatwagni. Then Acharya Charaka ने Grahani Prakaran में प्रपाग शब्द का प्रयोग किया है. So in Grahani chapter, Acharya Charaka has introduced one term that is called Prapaka. Then चक्रपाणी ने रात्रि में गरम दधी का सेवन निषिद्ध किया है. So according to Chakrapani, in the night time we should not have the curd. Okay, hot curd you should not have it during the night time. Okay, so garam dadi, like the hot curd is contraindicated in the night time according to Chakrapani. वाग्भटा ने मूत्र वेगरोध से अंगभंग एवं अश्रु के वेगरोध से गुल्म की उत्पत्ति मानी है. अकॉर्डिंग टू वाग्भटा, इन मूत्र वेग धारणा अंगभंग, that condition will be getting. Okay, you are getting severe cutting type of pain or there is a breaking body parts will be feeling. Ashru vega dharana, if you are suppressing the tears, so that time you will be getting gulma roga according to Vagbhata. Okay, so Vagbhata and Charaka both are telling same conditions. Okay, so extras which is told by Vagbhata in Mutra Vega Dharana is Angabhanga. In Ashru Vega Dharana, Vagbhata is telling Gulma Roga is happening. Okay, then साधारण काल में प्रायः मिथ्या योग ही होता है, अतियोग या अयोग नहीं. Like adiyoga, ayoga, okay, mithya yoga of kala, artha, karma, like that classifications are there based on the disorders. Okay, so just understand in sadharana kala we usually create mithya yoga, not adiyoga and ayoga of dravyas. Okay, so just understand in sadharana kala mithya yoga only happens, ayoga and adiyoga of the dravyas will not happen in sadharana kala. Next one is कुष्ठ को कर्मज रोग भी कहा गया है. Like we know that kushta is considered as a due to papa karma we are getting kushta roga. So that is a belief. So it considered as a karmaja roga. Because of the karma you are getting kushta roga. Okay, if you have done any papa karma you can get kushta in the next birth. So that's why it is considered as a karmaja roga. Next one is Pranacharya Guna. Okay, so 5 gunas are there for Pranacharya. Then Paratva evam Aparatva Guna Akash mein nahi rehte hai. So Paratva Aparatva Guna that you can't found in these 2 gunas you can't see in the Agasha Mahabodha. Then Marshanasya Pramana. Okay, so Uttama is 10 bindu, Madhyama is 8 bindu, Kanishta is 6 bindu. So 10, 8, 6 is the 6 bindus are the dosage of the Marshanasya. Dosage of Pradimarshanasya is 2 bindu. Then कुछ प्रमुख व्याधियों में वर्जित कर्म. So some procedures it is contraindicated in some disorders. Okay, so apatandraka. In apatandraka, apatarpana, vamana, astabana, anuvasana, these treatments are contraindicated in apatandraka. Okay, apatarpana, vamana, astabana, anuvasana. So these treatments are contraindicated in apatandraka. In avabahuga, rekta mokshana is contraindicated. Then prameha pidika, prameha, in these conditions Vedana is contraindicated. Then Udara Roga, Vamana and Anuvasana Vasti is contraindicated. In Chidrodara, Svedana Karma is contraindicated. Then in Kshayaja Roga, whole Panchakarma is contraindicated. Okay, in Kshayaja Shiroroga, Nasya, Vamana, Svedana, Dhumapana, Rekta, Mokshana, the full Panchakarma is contraindicated in Kshayaja Shiroroga, because in Kshayaja there is Dhadu Kshaya is there. So already Dhadu Kshaya is there. Then again if you are giving Panchakarma, then what happen? Again the once more Kshaya will be happen. So the condition will become worse. So that's why Panchakarma is contraindicated in Kshayaja Shiroroga. Rest of the all disorders, only 1 or 2 procedures are contraindicated. So this is important. Okay, so in Apatandraka, Apatarpana, Vamana, Astabana, Anuvasana is contraindicated. In Avabahuga, Rektamokshana is contraindicated. Prameha Pedika, Prameha, Svedana is contraindicated. Udara Roga, Vamana, Anuvasana Basti is contraindicated. Chidrodara, Svedana. In Kshayaja Roga, Panchakarmas are contraindicated. Then अश्मरी व भगंधरा शस्त्र कर्म के पश्चात 1 वर्ष तक स्त्री सेवना का निषेध सुश्रुत ने बताया है. So in Ashmari and in Bhagandhara, if you are doing surgery, okay, if you are doing surgery for Ashmari and Bhagandhara, for till 1 year you should not do Maidhuna. Okay, so that is contraindicated. This is according to Sushruta. Okay, so Sushruta is telling if you are doing surgery for Ashmari and Bhagandhara, so till 1 year the person should not go for Maidhuna karma. Then ingredients of the Navayasa Loha. Okay, Trifala, Trikadu, Vidanga, Chitraka, Mota, Loha. So these are the ingredients of the Navayasa Loha. Then सुश्रुता ने सम्यक स्निग्ध के लक्षणों में ग्लानि का होना एवं अधिस्निग्ध लक्षणों में प्रवाहिका एवं गुददाह का होना चरग से अतिरिक्त माना है. So what are the lakshanas which is told by Charaka in सम्यक स्निग्ध लक्षण, अधिस्निग्ध लक्षण, additionally some points which is told by Sushruta. Okay, so the Samyik Snigdha Lakshana according to Charaka, according to Sushruta same. Only 1 point extra Sushruta has mentioned, that is Glani. Okay, so Glani comes under Samyik Snigdha Lakshana according to Sushruta. Okay, in Adi Snigdha Lakshana, the same as Charaka has mentioned, additionally 2 points which is added by Sushruta, that is Pravahika and Gudadaha. Okay, so these are the additional points which is told by Sushruta. Then Vishesha Paristitiyam ke anusar Svedana. So based on the condition, which type of Svedana has to be given. For Kapha Nashanartha, for reducing the Kapha dosha, which other Sveda is indicated? Taba and Ushma Sveda is indicated. For Vada Nashana, Upanaha Sveda is indicated. For Kapha या वाद के साथ पित्त का अनुबंध होने पर कफा एंड वादा both are vitiated and associated with the pitta is there, then you should go for Drava Sveda. Okay, Kapha or Vada. Okay, Kapha or Vada has become vitiated. Associated with Pitta is there. Then you should go for Drava Sveda. Okay, Kapha Pitta or Vada Pitta. This type of condition you should go for Drava Sveda. वायु के कफ व मेद से युक्त होने पर वाद कफ मेद. Okay, वाद कफ मेद. These 3 things are there. Then you should go for Nirakni Sveda. Okay, so based on the dosha vitiation, you have to choose the Sveda. For Kapha, Taba and Ushma Sveda. For Vada, Upanaha Sveda. Kapha Pitta or Vada Pitta, Drava Sveda. Vayu Kapha Meda, Nirakni Sveda. Then पूर्व में स्वेदन योग्य परिस्थितियां. So like before doing the procedure we have to do svedana karma. In which all the procedure it is indicated? Nasya, Basti, Shodhaniya Purusha. Before doing Nasya karma we have to do svedana karma. Before doing Basti also we in Basti also we are doing svedana. In the Udara Pradesha we are giving mild sveda, then only we will be giving the Basti karma. In Shodhaniya Purusha, which means before doing the Vamana and Virejana we have to undergo svedana karma. Okay, so Nasya, Basti, Shodhaniya Purusha, in these three conditions you should give Svedana before starting the procedure. Paschatame Svedana Karma, like after the procedure you have to give Svedana, in which all the condition? Muda Garbha and Samanya Prasava, like after the normal delivery, after the Muda Garbha. Okay, so in these timings, in these conditions, after the procedure you should give Svedana Karma. Okay, after removing the Muda Garbha, after the normal delivery, you have to give Svedana to the lady. Okay, after procedure, Svedana Karma is indicated in Muda Garbha and Samanya Prasava. Purvava Paschat Svedana Yoga, which means before the procedure also you have to do you have to do Svedana. After the procedure also you have to do Svedana Karma. Okay, Purva Paschat, before the procedure, after the procedure, if you wanted to do Svedana, which are the condition? Ashmari, Arshas, Bhagandara. Okay, Ashmari, Ashas, Bhagandara, in these three conditions, Purva Svedana is also there. After the procedure also you should do Svedana Karma. Okay, next thing is सम्यक स्नेहन के एक दिन पश्चात वमना एवं 3 दिन पश्चात विरेचन दिया जाता है. Like after the proper snehapana, like after the सम्यक snigdha lakshanas you have getting, then after the सम्यक snigdha lakshana, after 1 day you should go for the vamana karma. Okay, सम्यक snigdha lakshanas you have got, then 1 day rest, then next day you have to give vamana karma. For virejana, after getting सम्यक snigdha lakshana, after 3 days you have to give virejana karma. Okay, getting Samik Snigdha Lakshana, then leave a gap for 3 days, then you should do Virejana Karma. For Vamana Karma, getting Samik Snigdha Lakshana, 1 day gap, and then you have to give Vamana Karma. Okay, so these things are mentioned in the 65th page. Okay, so rest 66 will start on next day.